Well, with that, let's shift our focus back to our corporate radar, and on our radar is Syngene International. That company received the Indian Council of Medical Research, or what you call ICMRS, approval for its COVID-19 antibody test kit, which it has developed along with HiMedia. Mahesh Bhalgat, the COO of Syngene International, joins us now. Mahesh, good morning, and thank you very much for joining us. If you can begin by telling us what's special about this kit. Is it one more, or is it different from the kits that are already available?
So good morning. Let me just explain about the kit that we have been approved by ICMR.
Yeah.
This is an antibody kit which measures the response to the virus that is there. Therefore, is a very good way of understanding serosurveillance in populations, which is a very important component of how governments, hospitals, frontline workers, and corporates can think about measures that they need to put in for interventions and management of the disease.
Yes. Actually, we went through one in our own office, so we are somewhat familiar with this antibody kit. Can you tell us whether what is the pricing? Are there any restrictions from the government on even these kits, or is it only for the COVID testing kits?
So, let me talk a little bit more about the kit from a performance perspective, because I think what is really important to understand from a utilization of these kits is that the performance is very important, which means you need to have a kit that does not have a very high false positive rate or a very high false negative rate, which is referred to as a sensitivity and specificity. So our kit, when tested by ICMR, has had a performance between 98 to 100%, which gives a lot of reliability in the results, and therefore is a kit that is applicable in these situations. Coming to your question around pricing, we expect to price this kit, and HiMedia will be the one who is actually doing the manufacturing and distribution, will price the kit in the range of about 200 rupees a sample. The kit is capable of conducting 90 tests in one go, and therefore has a high throughput, and at a cost of about 200 rupees a sample. This will make it a very affordable kit for corporates to do mass testing and therefore implement higher level of serosurveillance within their populations.
All right, that makes sense from the corporate point of view, from your buyer's angle. But what about from your angle? I mean, what is the cost that you are putting in, and when do you expect to be able to make money on it?
So Syngene has partnered with HiMedia, and what we've brought to the table is we've done the development of the kit. We've all of the scientific basis behind the kit. We've also developed some of the critical reagents that are required for the kit to work very well. So the Syngene angle for this is to bring in the high quality science and to continue to provide the reagents that are required for the mass production of this kit. In terms of your question around, when do we expect to make money on this kit, I think that's going to be based on how the uptake of the kit is by all of the potential partners and potential customers that HiMedia will be targeting, whether it's the hospitals, governments, or corporates. So I can't really comment on how that uptake will be, and therefore what will be our realization in terms of the revenue potential from this.
Oh, okay. So you can't speak whether it'll be margin accretive. And by what time? Like, will it be margin accretive this year itself?
If it has to be margin accretive, it will be this year for sure.
Okay.
But
this is the time you need it, yes.
It's going to really depend on the uptake of the kit in terms of its utilization.
All right.
The reason we've partnered with HiMedia is, one, they have a very good outreach within this particular segment with all of the clinical labs and the hospitals and so on. But they also have a high capacity to ramp up the production once we have the uptake that is happening.
Okay, I'm sorry, I'm going to be asking you more revenue related issues while we are, as citizens, happy that more such kits whose sensitivity is better are coming in. Your viewership is largely investors. So if you can tell us, what is the split between HiMedia and you in terms of revenues?
I actually can't get into those details in terms of how we have gotten into the commercial agreement with HiMedia. I'm sorry.
You can't speak about that. Okay, can you tell us how much investment you will make in this?
We've already, as you know, we are a company that makes novel proteins all the time.
Okay.
So for us, this was incremental investment
Okay.
to make the reagents available, which is what I'm referring to as the key components of what the kit uses for producing.
Okay.
And so therefore, for us, it's
Partly the production is already on, is what you're saying.
Absolutely.
Okay.
And this does not need additional investment from us to actually to produce the reagents that I'm referring to.
You still need one approval, right, from the CDSCO? Only then you launch?
Absolutely. So the way the kit approvals are is that there is the ICMR approval followed by the CDSCO approval. The CDSCO approval steps is something that we are going through right now at the HiMedia facilities. That should be happening over the next literally a matter of few more days before which it then gets launched.
All right. Okay. Then let me come to businesses where you can talk and are not worried about this. How's Q2 fared so far? Is it normal capacity? What is the capacity utilization levels? And therefore, your visibility for Q2 and Q3?
So from a capacity utilization levels, we've been operating our facilities at about 90 to 95% staffing, given that we are an essential services business and therefore have been able to serve all of our corporates very well. When you think of our customer base is primarily those from the US and the European markets, where they have been operating at lower rates and actually have been bringing us the business so that we can keep their pipeline going. From a Q2, Q3 perspective or the rest of the year perspective, I think we would still maintain that we would be in the low teens sort of a growth rate that we have already communicated earlier this year.
Oh yeah, you did communicate double-digit guidance growth, and that was going to be my last question to you. You also communicated margins of 30%. You will stick with that?
So we don't expect that any of the things that we've said before from a guidance perspective will change at this point of time.
All right. Pleasure speaking with you. Thank you very much for joining us with all those details, Mahesh.
Thank you. Thanks a lot.
Okay, all the very best for that kit, and we do hope that gives us more reassurance about India's own herd immunity, something we desperately need now. Well, just a word before we take a break.